I'm Ryan Miller,
I'm Eli Benakonsky.
and this is the shoulder evaluation for AIM 2.
For the sake of time, we're going to be doing a unilateral evaluation.
This is our patient, Jeff. Jeff, for the duration of the video today, do we have permission to touch you?
Yes.
So we're going to start with a complete history. So first we're going to ask any previous history with the shoulder, any injuries, any surgeries, anything like that.
Yes, obviously, as you can see by my battle scar right here, I used to race dirt bikes as a kid, and one day I went over a big jump and landed right on my right shoulder and ended up spraining my AC joint.
Have you ever dislocated the shoulder before?
No,
Do you ever hear any clicking, popping, any noises when you move your shoulder around?
depending on what I'm doing.
Explain it. Like what do you hear?
When I'm lifting weights and I bench press, I can feel my shoulder clicking in and out of place.
So looking at the shoulder, we see there's some discoloration right here.
Ecchymosis.
Yeah, some ecchymosis. No swelling noticeable.
Are you feeling any pain in either of your shoulders?
3 out of 10 on the right.
So now we're going to move on to the bony palpation. So the first one we have is the clavicle. So you get right in here. You can feel it all the way across.
All right, the next palpation is going to be the AC joint. So the AC joint is up here on top of the shoulder. Then you palpate on those sides.
Okay, next is the scapula. So if we pull the shirt down a little bit, you can see the scapula is going to be right here.
Our next palpation is going to be the greater tubercle. So for that, the acromion is above, then you work inferior and anterior and find the greater tubercle. And then after that, you can move medially and find the bicipital groove. And then once again, you can move medially and find the lesser tubercle.
Next palpation is the deltoid tuberosity. So we're going to go just below the deltoid, right to about there. Once we go find it.
So the next step is going to be fracture testing. And for the first fracture test that we're going to be doing is testing the clavicle. And then you're just going to push down on the clavicle on each side.
A positive fracture test would be pain upon depression of the clavicle. Next section is soft tissue palpations. So we're going to start with the SC, the sternoclavicular ligament. So right here, we're going to find the clavicle and go all the way to the sternum, right to there. And it's right in between on both sides.
So the next one is the corticoclavicular ligament. For that, you're going to follow the clavicle, the acromion, down to the coracoid process. Then after that, you want to palpate up, and it consists of the trapezoid ligament and the conoid ligament. Next is muscle palpation. The first muscle is the pec minor. The pec minor originates at ribs 3 to 5 on the costal cartilage. It inserts on the coracoid process of the scapula. Its action is stabilizing the scapula by drawing it anteriorly and inferiorly, and it's innervated by the medial pectoral nerve. So you would find the coracoid process and then work down. The pec minor is underneath the pec major.
Next up is the rotator cuff tendon. The rotator cuff tendon is made up of the supraspinatus, infraspinatus, teres minor, and subscapularis muscles. The first one is the supraspinatus. The origin is the supraspinatus fossa of the scapula. The insertion is the greater tubercle of the humerus. Its action is the first 30 degrees of abduction, and it's innervated by the suprascapular nerve C5, C6. So you find the spine of the scapula right here. It's just above it. And we go over and insert the greater tubercle.
The next muscle is the infraspinatus. The infraspinatus originates on the infraspinous fossa on the dorsal surface of the scapula. The insertion is the greater tubercle of the humerus. Its action is external rotation of the humerus, and it assists in stabilizing the glenohumeral joint, and it's innervated by the suprascapular nerve. This is the palpation of the infraspinatus. The infraspinatus is inferior to the spine of the scapula.
The next muscle is the teres minor muscle. Its origin is the superolateral portion of the scapular border. It inserts on the greater tubercle of the humerus. Its action is external rotation, and it's innervated by the axillary nerve C5, C6. So we find the infraspinatus, it's just inferior to that. We go over here, and they all have the same insertion point.
The next muscle is the subscapularis. The action of the subscapularis is internal rotation. It originates on the anterior surface and axillary border of the scapula. It inserts on the lesser tuberosity of the humerus, and is innervated by the upper and lower subscapular nerves C5, C6, C7. And you can't palpate the subscapularis because it's on the anterior portion of the scapula.
The next muscle is the biceps brachii. The biceps brachii is broken into the long head and the short head. The actions of the biceps brachii are flexion of the elbow and supination of the forearm. The long head of the bicep originates at the supraglenoid tuberosity of the scapula, and the short head originates at the coracoid process of the scapula. They insert on the radial tuberosity and the aponeurosis, and they're innervated by the musculocutaneous nerve roots C5, C6. So the long head of the bicep is going to be on the outside or the lateral side, right here. Short head of the bicep is going to be on the medial side, here. And that's the long head.
The next muscle is the anterior deltoid. Its action is flexion, abduction, horizontal adduction, and internal rotation. It originates on the lateral 1/3 of the clavicle. It inserts on the deltoid tuberosity and is innervated by the axillary nerve C5 and C6. So it's the anterior deltoid.
The next muscle is the posterior 1/3 of the deltoid. Its action is extension and horizontal abduction. It originates on the spine of the scapula and inserts on the deltoid tuberosity, and it's innervated by the axillary nerve C5, C6.
The next muscle is the latissimus dorsi. Its action is extension of the humerus, internal rotation, and adduction. It originates on the spinous processes of T6 to T12 in the lumbar vertebrae. It inserts on the bicipital groove, and it's innervated by the thoracodorsal nerve, and that is C6, C7, and C8. And the lat goes from the lower back, and it works the whole ways up, and then it goes through the armpit and connects on the bicipital groove. So you would palpate all of this area. And then it would insert right here.
Next is the triceps brachii muscle. There are three parts of the triceps, the long head, the lateral head, and the medial head. So the long head is, the origin of the long head is the infraglenoid tubercle of the scapula. The lateral head is above the radial groove, and the medial head is below the radial groove. They all insert on the olecranon process of the ulna, and the action is to extend the forearm. The long head extends and adducts the arm at the shoulder joint, innervated by the radial nerve C6, C7, C8. So right here, the lateral, the medial, and then the long head right here. And you can see it really good if you have your patient flex their forearm just by pushing their wrist down to the floor. See lateral, medial, then long. If you bring your arm out here, the long is right there. Okay, so we have a new patient here. So this is Blaze. Blaze, do I have permission to touch you throughout the course of this video?
Yes.
Okay, thank you.
Blaze, I have permission to touch you?
Yes.
So the next test is going to be range of motion testing. So first we're going to test extension of the humerus. So we're going to align the axis on the greater tubercle. Right here, we're going to hold the stable lever arm out here like this so I can hold on to it. And then the movable lever arm we're going to keep in line with the humerus. So Blaze, I'm going to have you bring, when I tell you, I'm going to have you bring your wrist back and try to bring it toward the ceiling as far as you can go. So ready? Go ahead and do that for me. Good. We got about 54 degrees right there. We're going to do the passive portion of it, so I'm going to push Blaze a little bit further. And we got to 60 degrees, so right where it's supposed to be.
Next up, we're going to be testing external rotation. So I'm going to align the axis with the electron arm process, and then I'm going to align the movable lever arm with his forearm, and then Blaze, I'm going to have you bring your wrist to the floor. So he got to about 89 degrees, and then we're going to test for passive. And he got to about 96 degrees.
Next, we're going to be doing muscle testing. First is going to be the anterior deltoid. So for that, we're going to go through active range of motion, active resistance, and the brake test. So first, active. Blaze, I'm just going to have you raise your arm up to about shoulder length right in front of you. Good, just like that. Okay, now I'm going to apply some active resistance. So I'm going to support right on top here. And same thing, just do that same range of motion. Good, one more time. Good, okay. Now the brake test, I'm going to find about halfway. Just rock your arm for me. About halfway, so we're going to go right here. Blaze, hold your arm right there for me. I'm going to try to push your arm down, and you don't let me. Just try to keep it right there, okay? We're going to go for 5 seconds, okay? Ready? Go. 1, 2, 3, 4, 5. Blaze had full strength in his shoulder. He was at 100%, so that would be a 5 out of 5.
Next up, we're going to be testing the biceps. We're going to test the long head and the short head. So Blaze, I'm going to have you bring your arm back, and then when you come through the motion, you're going to turn your arm. All right, so I'm going to have you do that. All right, now I'm going to provide some resistance, so go ahead and do the same thing. Good. All right, now relax. I'm going to push you down. Don't let me push you down, okay? 1, 2, 3, 4, 5.
Next, we're going to be testing upper trap. For this, I'm just going to have Blaze bring his shoulder up to his ear. So Blaze, go ahead and do that actively. Now I'm going to apply some active resistance here. So I'm going to support. Put it right here, then go ahead, same thing. Good, okay. Now I'm going to find, so bring your shoulder up and then go about halfway down. So right there. Okay, hold your shoulder there for me. I'm going to try to push you down. You're going to resist me for 5 seconds. Okay, ready? Go. 1, 2, 3, 4, 5.
Next, we're going to be testing the pec major. So Blaze, I'm going to have you hold on to the table, and then I'm going to have you bring your arm up here and bring it across your body. Good. Now I'm going to provide some resistance. All right, now I'm going to have you, I'm going to push down. Don't let me push you down. Go. 1, 2, 3, 4, 5.
Next, we're going to be testing the infraspinatus muscle and the teres minor muscle. So you're going to have your patient laying on their stomach with their arm right here at 90 degrees. First thing I'm going to do, Blaze, try to raise your wrist up to the ceiling. There you go, good. Now I'm going to apply some active resistance. So I'm going to support it right here. Go ahead, same thing. One more time. Good, okay. Now we're going to find the halfway point. So we're going to go right there. I'm going to try to push your wrist down. Don't let me, okay? For 5 seconds. Ready? Go. 1, 2, 3, 4, 5.
Next, we're going to be testing the serratus anterior. So, Blaze, I'm going to have you bring your arm up like this and try to bring your shoulder up to the ceiling and off the table. Good. Okay, now I'm going to provide some resistance on the shoulder and on the elbow. All right, now come up halfway. I'm going to push you down. Then let me push you down. 1, 2, 3, 4, 5. Good.
Next muscle test is the latissimus dorsi. So for this, I'm going to have Blaze bring his arm down here like this, and then I'm going to have you hold on to this side. So I'm here, scooch over the edge of the table here, just like that. Okay, good. Now I'm going to have you bring your elbow back up to the ceiling, just like that. Yep. Good. Now I'm going to apply some active resistance, so go ahead, same motion. Yep. Good, okay. Now we're going to find the halfway point. Go right about there. Same thing. Don't let me push you down, okay? Mm-hmm. Ready? Go. 1, 2, 3, 4, 5. Good.
Next, we're going to be testing the middle and lower trap. So, Blaze, I'm going to have you put your arm on your back. Okay. Now, bring your elbow up. Good. Okay. Now, I'm going to resist. Go ahead. All right. And then we're going to go halfway. Don't let me push you down. 1, 2, 3, 4, 5. Good. All right. Now, Blaze, I'm going to have you scoot to the side a little bit. and scoot up a tiny bit. Alright, now I'm gonna have you bring this, come up even more. I'm gonna have you bring this arm over your head like that. Okay? Then you can go through again. Alright, good. Now I'm gonna resist you. Go ahead. Alright, now we're gonna go halfway, then let me push you down. 1, 2, 3, 4, 5. Good.
Okay, next we're going to be moving on to special testing. So the first special test is the O'Brien's. So I'm going to have Blaze raise his arm up in the plane of the scapula, and then I'm going to have his thumb pointed down, so we're going to be in an empty cam position. The support here, and I'm going to push down. And then next I'm going to have Blaze's palm up. I'm going to do the same thing, push down. So a positive test for this would be pain when the thumb is down. So pain when I'm pushing here, and then as his palm goes up and I push, the pain would go away or there would be no pain.
The next test is the Yergeson test. So I'm going to be pushing down and rotating out on the patient. And then a positive will be pain in the bicipital groove or snapping.
The next special test is the Speeds test, which tests for bicep tendonitis. So I'm going to have Blaze palm up, kind of the same as the O'Brien's, and just fully extend, and then I'm going to apply some resistance. So go ahead. And then if there's any pain, that would be a positive.
The next test is the Hawkins-Kennedy test. So I'm going to bring Blaze's up into his arm up to 90 degrees. I'm going to internally rotate him and then push him across. And the positive test would be pain. And it also is testing for shoulder impingement, rotator cuff impingement to be specific.
Next test is the Nears test. So for this, it's testing for shoulder impingement. So I'm going to have Blaze keep his thumb down, and then we're going to move his arm up here. And then a positive test here would be pain at the top of the range of motion right about here.
The next test is the supraspinatus test. So I'm going to have Blaze bring his arm out here. I'm going to push him down. And a positive result would be pain.
Next test is the sulcus sign. So this tests for glenohumeral laxity. So I'm going to stabilize at the scapula right here, hold that in place, and then I'm going to grab just above the elbow. And then all we're going to do is pull this down like that. And if we see a sulcus or kind of like a muscle cramping looking piece right here, that would be a positive sign.
Next we're going to be testing for thoracic outlet syndrome with the 3 different special tests. So the first one is the Adson's test, and I'm going to bring his arm back, and I'm going to find his radial pulse, and then I'm going to have him look down towards his arm. If the pulse diminishes, that'd be a positive. The next one is Allen's. I'm going to have him bring his arm up, and then look away. And then it's the same. You're feeling for the radial pulse. Then the last one is military brace. You find the radial pulse in both arms. Bring the arms back and have him tilt his head back. Good.
Next test is the apprehension test, which tests for anterior shoulder instability. So I'm going to have Blaze bring his arm up at 90 degrees. I'm going to push the humeral head forward and pull his wrist back just like this. And a positive test would be pain.
The next test we're going to be performing is the ground test. So I'm going to bring the patient's arm up like this. I'm going to push down and internally and externally rotate. Then circle back. And a positive would be pain.
Next special test is going to be testing the pec minor. So I'm going to have Blaze put his hands just across his chest on his sternum there. And now we're going to be looking down here to see if the shoulder is flat on the ground or on the table, which it is. So that's a negative test. If his shoulder would be raised or, not flat on the ground, that would be a positive test. And then for the pec major test, I'm going to have Blaze put his arms over his head just like that. And then bring your elbows down to the table on both sides. And since he can do that, there's no tightness in either his pec major or pec minor. A positive test would be as if his shoulders were up like that, couldn't go all the way down. Okay, the next test is a scapular wing test. So I'm going to have Blaze put his arms on the wall just like that. Bring his chest forward and then back out. And now we're looking at the scapulas back here to make sure they're flat, which they are. So this would be a negative test. Positive test would be if the scapulars are kind of sticking out or not flat on his back. So Blaze, if you want to move around, yeah, something like that. If that's how it looked, that would be a positive test.
The final special test is the drop arm test. So I'm going to have him bring his arm up over his head like this. And then I'm just gonna have him bring it back down to his side slowly. Go ahead, do it again. Slower this time. And a positive would be if his arm got through around here and he couldn't support it and it just kind of dropped like that.
Okay, for functional testing, Blaze here is a linebacker. We're going to say he had a pec major tear. So he's gone through the rehab, he's gone through physical therapy, and we're ready to get him back to return to sport. But we want to make sure this muscle is, fully healed and fully ready to go because he does a lot of blocking and shedding and things like that. So we're going to do the pec major test again. So we're going to have Blaze actively bring it across. Okay, good. Now I'm going to apply some active resistance. Go ahead. One more time. Good. Now we're going to do the break. So we're going to go right here. I'm going to try to pull you back. Don't let me, okay? Ready? Go. 1, 2, 3, 4, 5. So the pec muscle is 5 out of 5 in strength, so he should be good to return to sport.
The last part of his functional testing would be contact prep. So we would just put him through a little bit of sport-specific drills. All right. And then the next one, he could just shed the block. And then the final one would be contact prep. And then he's all good to go. Put him back on the field.